week is going to be endometriosis. I'm Lori of Women's Health on the Go, where we connect you with a women's health care provider for telemedicine for women, where we can take care of lots of little things: birth control, treat simple vaginal infections, talk about your menopause. So if you need an appointment, make sure you check out our website, womenshealthonthego.com. If you don't need us right now, make sure you sign up for our newsletter. You get a great book, a little book that talks about all these great things that you can do to take care of your girls and the vajayjay down there, and you get a special discount code for your first visit, so make sure that you sign up for that. So hello Nancy, welcome another dedicated viewer. So we're about to get into endometriosis. And why have I picked endometriosis today? Because it is actually Endometriosis Awareness Month. It is also Colorectal Cancer Awareness Month. So, make sure that you get your screening. If you're 50 or above, make sure you get your colorectal screening for that. But tonight we're going to talk about endometriosis. And I'm going to talk about it because it's very common. A lot of the times, the biggest symptom when people have it is pain. And a lot of the times when you go and, I'm a provider and, I know exactly if someone comes in complaining of pelvic pain, typically you're like, okay, do they have an infection? You're trying to rule out these kind of acute situations. And a lot of the times when you get through all of that stuff, the last thing, and we'll go into diagnosing endometriosis and how difficult it is. It's like, well, there's a possibility you could have endometriosis. And in that interim, sometimes people, depending on where they go and who they see, sometimes it could be years before they actually get a diagnosis of endometriosis. And then in that interim, they're in pain. They're not happy people. And endometriosis, because it could be so painful and debilitating for some people, it can cause, problems with having a sex life because it's, painful. Or, it can cause depression just because, you're in pain and you just, you can't handle it. And a lot of the times I think sometimes, when people unfortunately go from provider to provider and, you keep saying, I'm in pain, and it's hard on you, I mean, you feel like no one's hearing what you're trying to say, and it can be very very frustrating. So that's why endometriosis is really important, and it has an awareness month. So what exactly is endometriosis? Endometriosis is so the lining inside your uterus, when you find the tissue, like so when you think about it, inside the uterus, you have the endometrial lining, and that's the lining that develops every month for you to have a period. And when you don't, get pregnant, it sheds, okay? Endometriosis is when that kind of tissue is found outside the uterus. It can be found in lots of places. Typically, if someone's going to have it, it is going to be in the pelvic region. It may be, on the ovary, it may be, on the outside of the uterus, but it can also be in your bowels, it could be on your bladder. It has been found on the diaphragm, which is, the diaphragm is actually right under your rib cage. That's the bottom of the lungs that, goes up and down when you're breathing. So even though, all the way down here is where, the uterus is and stuff, you would think that maybe it's just in that area, but sometimes people have generalized abdominal pain. Because those little implants can be seen anywhere. Now, the symptoms, like I said, for the most part, it's pain. It's just depending on what kind of pain. It could be pain when you're having a bowel movement. It can have pain when you're having sexual relations. It could be typically when you're having your period, because if you think about it, that lining is shedding, and those little endometrial implants that are found outside, not necessarily that you're having internal bleeding in that area, but they are secreting something as well. So it can be very painful in the pelvic region as well. So you could have pain when you're exercising certain movements. You can have pain just sitting here and doing nothing. So it really doesn't, most of the time it's cyclic, like I said, during your period. But sometimes people can experience pain not necessarily with their period with this. And most of the time, like I kind of mentioned before, when you go to a provider's office and you say, I have pain, typically, one of the first things I'm always going to think of is, oh my gosh, do you have an infection? So you're going to get ruled out an infection. So most of the time people are misdiagnosed with an infection, or they can be misdiagnosed with what we call adhesions. Adhesions, especially if people have had surgery. So what adhesions are basically is, typically your skin, structures do not connect each other. But then when you have surgery and, layers are cut, and when your body is healing, sometimes structures that were not previously connected now become connected. So that when you're moving, in various ways, you have pain in that area. So that's what adhesions are. So sometimes people are, misdiagnosed with that. Sometimes people are, people are like, it's just ovulation pain. Because sometimes women can experience a little bit of pain in their ovary during their period. Not during their period, mid-cycle. Take that back. Mid-cycle, when you are actually ovulating. So sometimes they can have pain. So you can be misdiagnosed with that. So it's very painful, it's very discomforting, and the majority of the time people are misdiagnosed, and it takes a while for you to actually be diagnosed with endometriosis. But the problem is that there's a huge amount of people that actually have endometriosis. Some people don't even have symptoms, which, that would be really nice if that was the case, but some people, don't even have any symptoms. 50% of the people with infertility will end up having endometriosis. 40% of adolescents with genital tract anomalies have endometriosis. And 70% of women and adolescents who have pelvic pain actually have endometriosis. So that just kind of shows you how often and how many people actually have endometriosis, but probably don't end up getting diagnosed. Again, some of the typical areas that I did tell you is most of the time it's found in the pelvic region. It can be found in the diaphragm and other areas. It has been rarely found in other areas such as your breasts, or I even heard of, like one time, like there was an implant on somebody's kind of shoulder, up in the shoulder area. So it can be other places. It doesn't mean that it's spreading. It just means that, so endometriosis doesn't spread. It's not like, you have a little piece here and all of a sudden, it spreads throughout the whole body. It may locally kind of, regenerate in that kind of area, but it's not going to, like if I start here, it's not going to go throughout my whole body. So it's not necessarily going to spread throughout the body. How do we get endometriosis? There is a theory. It's called the Sampson theory, which is basically the theory that it is caused by a menstrual upflow. So like that, instead of when you're bleeding, when you have your period, the blood is supposed to come out, that it actually, goes backflow through the fallopian tubes, out of the ovaries, and into the pelvic region. The problem with that theory is that there has actually been diagnosis of endometriosis in adolescents who've never had their period yet. So it's not, I guess it could be possibly a theory, but in reality, it doesn't necessarily mean that that's what's going to cause you to have endometriosis. So hopefully that made sense. Risk factors that can cause this. So one of the things this is an estrogen, and this is caused by an excess of estrogen. It's an inflammatory disease, which, when I talk about this later, I hope that everybody who watches this show, for the most part, when I ever talk about anything here, most of the time I'm talking about inflammation in the body. Inflammation in the body. And I hope that a lot of people realize how much inflammation in the body causes lots of various medical issues that can happen with us. everything, I think, for the most part, most of the follow-up that I'm going to say of what you can do is following an anti-inflammatory diet, decreasing stress. You know, we got to get that inflammation out of our body. So hopefully people who watch all of my shows are realizing that almost everything in our body is caused by inflammation, because I'm going to keep saying it probably with a lot of other conversations that we have. But again, this is an inflammation issue. It is from estrogen excess, but it is a benign condition. It's not cancerous or anything like that, but it is benign, but it is inflammation. So when we look at risk factors of who is more likely to end up with endometriosis as compared to the next person, one, because of excess of estrogen, it's going to be people who either get their periods really, really young, and then they go through menopause really late, because then they have that long time of exposure to estrogen. Women who've never had children, because they're going to have, again, a long exposure to, estrogen. When your cycles are short, typically, cycles can be around, the average of 28 days. When your cycles are really short, then you may possibly have an excess of estrogen and a deficiency in progesterone. And then also people who have very heavy periods are typically a risk factor. And then people who are overweight, because they have a lot of excess estrogen in their body as well. So those are things that are risk factors for it. Let's see, where are we going now? All right, diagnosing. This is probably the hardest thing to diagnose, because the only absolute way to diagnose someone with endometriosis is to actually have surgery, and then for them to actually take one of those implants that they see and take them and take them to the lab. And that's not feasible for everybody. And it's not, going under, having surgery is a really huge process. It's, could be dangerous. And so that is the absolute definitive way to diagnose, which this makes it very difficult to diagnose. Now, sometimes you can see things on pelvic ultrasounds. Now, the most common way that we can see them on ultrasounds is especially if you have one around your ovary. Sometimes when people have, they're having pelvic pain and you send them for an ultrasound, sometimes you may get a report that says either whether it's an ovarian endometrioma or they see a cyst. It looks like a hemorrhagic cyst, but it also could be an endometrioma. Sometimes they can't really quantify what it is. So that's sometimes how they can see it, but that's not also a guarantee. Also, sometimes when they find it on the diaphragm, an MRI can figure that out, but not everybody who has pelvic pain is going to end up with an MRI, to be honest with you. But the only way, again, is to have surgery, and that's the only definitive way. Sometimes when we talk about treatment options, there are sometimes people who end up having surgery, but I would definitely highly recommend that you find somebody that's very experienced in treating endometriosis. Because endometriosis, when we speak about these little implants that are throughout the pelvic region, most of the time they are characterized as these powder burn appearance, or like little dark powder burn lesions, appearing lesions. But they can also be they can even be clear. They can be red, when you look at, they can be blue. When you look at the information about it, I don't perform surgery, so I've never seen them inside of anybody, but when they actually show pictures of them, which I always say that I should have more visuals. I've got to get better at that. I think, yes, I need to get better on visuals for everybody, because I think visuals are actually pretty cool. But they could be lots of different colors, and if you are going to have surgery, you want to make sure that someone is trying to get all of those endometrial implants, because if you just, take the ones that are you know, the dark powdered ones and you're not looking throughout the whole region, you know, you still may end up having pain afterwards. So, you know, I think that's really important if you're going to end up doing that. So let's talk about how it's treated. You know me, I always like to do the conventional way, and then I also like to do the natural herbal way. Now, conventionally, typically for me, if I have someone who comes with pelvic pain and they, you know, we go through, as I said before, oh my gosh, did you have an infection? You know, what exactly are we dealing with? Sometimes you just go, okay, there's a good possibility that you have endometriosis. And one of the first lines of treatment that typically most providers do will put somebody on birth control pills. Sometimes they will put them on continuous birth control pills, or sometimes, you know, still cyclic. You can just, you know, cyclic means that you just take the birth control pills as prescribed, and, you know, you take them for 3 weeks, and you have a week off, and you get your period. Or sometimes people actually will put you on continuous form of birth control, which is basically taking it and not even stopping and actually not having a period, because basically what they're trying to do is prevent you from having a period, because of the theory that when you are shedding your lining, these implants are also not necessarily bleeding per se, but they're also kind to excrete, and they're going to cause pain. So you don't want to have that anymore. Hopefully that makes sense. Another thing you can do is, so there's two different types of birth control pills. There is the ones that contain estrogen and progesterone, and then there's one that just contains progesterone, which is called the mini pill. So you can also do the mini pill. You can do a Mirena IUD, which has just progesterone in it as well. You can do the depot injection. I'm just trying to think in my head, okay, let me think of all of the progesterone birth controls. So you can do like the Depo Bravera, you can do progesterone only mini pills, or you can do the Mirena IUD. And that will, you know, typically that helps. Absolutely, typically helps. You can also just take what we call NSAIDs, non-steroidal anti-inflammatories, such as ibuprofen. You know, that can help by it, but you just got to take it while you're having your period. So sometimes taking those kind of pills all the time is not really good for you other health-wise. Then there is what's called danazol, which is like a synthetic steroid. It's like testosterone, and that just kind of decreases the hormones. But the problem is with that, you can sometimes get like facial hair loss, so sometimes people don't really like taking that one. And then there's another one where they give, it's called Lupron, and basically that induces menopause, basically, because it just basically turns off your ovaries completely, so they're not functioning anymore, therefore you're not getting your period anymore. And but you know, it's like a pseudo menopause. So then now you're going through menopause. Now you got all the menopausal symptoms going on. You got, you know, vaginal dryness, you got hot flashes, you got mood swings, you know, you got all those kind of things. So, you know, is that the best therapy? I don't know. You know, to me, if I had endometriosis, I'm not quite sure that's the one that I would be picking per se. And of course, I talked about surgery, which is not always successful, because when you have surgery, they have to make sure they get rid of all of the endometrial implants in the pelvic region, and that could be a lot. And depending on who's doing the surgery and making sure that because typically, like I said, if they have those powder burn lesions, you know, you can also have clear ones. You really have to make sure that someone's going to go really through that pelvic region and make sure that they get rid of all of the endometrioma implants throughout the whole body. So now let's go to my favorite part, which is always complementary therapies. This is always my favorite part. I think that they are, I think they're awesome, and I think that they work. I know that sometimes they're not perfect. I think that sometimes, you know, they don't work, but I do believe in them. I love them. I try to use all of them as much as I can in my own life, any way that I can, and I really encourage people to try to do those, because as much as, you know, modern day medicine is very good, some of this stuff is not really good for us, even though even I as a provider is prescribing medications to people, but there are a lot of people that die in this country from taking prescription drugs as directed. That doesn't happen with herbal medicine. I'm just putting that out there. Okie dokie, people. All right. So I really quick wanted to say hello to Katie and to Megan. Thanks so much for joining. Hopefully you're enjoying this. And hello to Patricia. That's here. There's a whole bunch of people here. There's a Donna. There's a whole bunch of people here. So hello and welcome, and I hope that you're having a great day and you're enjoying this show. All right, so let's talk about complementary therapies. One that I love, I tell lots of people about, and I'm going to be having in a future show an acupuncturist on the show. I'm very excited. I am in the midst of booking her, but acupuncture. Acupuncture is amazing. There is research that actually shows that it does help. So I highly recommend acupuncture. It could definitely help with your period and period pain. So definitely, if you can, I know that acupuncture can sometimes be a bit expensive, but some people have great insurance that covers it. And lucky you guys. And if you can do that, I definitely highly recommend acupuncture. This is always a tongue twister for me, but hot castor oil packs. I've talked to them about them, I think in my breast cyst show, in my fibroid show. People use them for ovarian cysts as well. There is no real, I love to find research. That's just me. I like to see research. I want to see research, and I want to see, you know, how does this stuff work? Does it work? So there's not a lot of research about hot castor oil packs, but I have seen people use them and have success with them. And I think that I got to do a video on how to do it, because it is a little bit of a system. But if you do a YouTube video, there's lots of people out there that use it. Castor oil is thought to be drawn out. It is, from what I understand, sometimes it is a little bit discomforting, but it's because it's pulling out, it's like drawing out the toxins and all of that stuff from your body. But I've seen definitely with fibroids, people have said that it's helped. With cysts on the breast, it has helped. And apparently people actually use this for endometriosis as well. So I definitely look into that. I will talk again about my anti-inflammatory diet. Definitely following an anti-inflammatory diet. People who have diets that are high in dairy and in red meats are shown to have a higher risk of endometriosis. So you definitely want to, you don't need to eliminate your red meat, but definitely decrease your amount. Get your fruits and your veggies, your whole grain fibers in there. Get your omega-3s, your cold water fish. Remember, this is an inflammatory disease. So what do we want to do? We want to get rid of the inflammation, and following an anti-inflammatory diet is one of the best ways to do that. I will probably talk about that diet in many of my videos, because I definitely think that it helps. Remember, a lot of disease in our body from inflammation in our body, from stress as well. So we want to get rid of that. Another thing, which I usually talk about a lot too, is exercising. Exercising, we should get at least 30 minutes a day of some type of exercise. I don't even care if it's after dinner, you go for a 30-minute nice stroll around the neighborhood. Get out there, get up. People who have a sedentary lifestyle, which is basically sitting on the couch doing nothing, have a higher risk of endometriosis and a lot of other things as well. I will talk about that with a lot of things, a lot of medical problems that are out there. Sedentary lifestyle is not good. So make sure you get out there and get out. So exercise is another great thing. I'm going to talk about homeopathy first, and then we're going to talk about little herbs. Now, homeopathy is a complementary therapy that basically, the way that it is that the theory is that you're going to treat like with like. Okay, so let's just take an example. Make a kind of simple example. So let's just suppose you are allergic to bee stings or bee stings, right? The theory is that if you give someone at a very low dose, not at a high dose, but the way homeopathy is you're giving a minute little dose of basically a bee sting, then it's going to counteract that and you won't have that reaction anymore. So basically that's how homeopathy works. It's a really cool thought process. What I think is interesting, so every week I get lots of emails about women's health. And what I've been finding lately, which I think is amazing, is I'm starting to find, because they're always full of pharmaceutical research. But what I'm finding lately is that they're talking about complementary medicine research. There was one about painful periods in ginger tea, and then just about 2 weeks ago there was one on homeopathy and endometrial pain. And what the research did is because, remember, this is an estrogen excessive, this is part of it, it's from an excess of estrogen in our body. So what they did is they actually gave very low dose of estrogen to these women in a trial as compared to like a placebo. And what placebo means is that they're really just getting sugar pills. And there was a significant decrease in their pelvic pain in the group that was given the very low dose of estrogen. So I think that is really, really cool. I think it's definitely something to look into. Homeopathy, I don't know a huge amount about homeopathy, but I think that it really is a really great therapy. If you look at the history of homeopathy, the history of influenza of 1918, okay, this was, I'm pretty sure it was based in Connecticut. Well, I don't know if you want to call it research, but basically these people collected data after this big influenza epidemic. And they compared to doctors that use homeopathy as compared to other, we'll call them conventional doctors that use like aspirin and all this basic stuff of what they had back then. And the incidence of people in the conventional medicine, they lost anywhere from 30 to 60% of the people that are inflicted with the flu. As compared to the people who use the homeopathy, 1 to 2% of those who were treated with homeopathy actually died from influenza as compared to 30 to 60% from conventional medicine. So I think that alone is that's amazing history. So I definitely think that homeopathy is something to definitely look into. Okay, herbs. When we talk about herbs, again, see, a lot of the things I'm noticing every show, I'm basically saying almost the same thing every show when it comes to how we should kind of take care of these things. Okay, we know that it's an excess of estrogen. We know that we need to, I talk about, you got to get the cleansing the liver, making sure the liver is working properly so that the body can process and eliminate any excess estrogen. So we want to make sure we use herbs that are liver cleansing, such as dandelion, a great weed that lots of people kill out of their yard, but instead of killing it and putting all that stuff on there, we should be picking them instead and using them. They're great, 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 great. Love dandelion. Or milk thistle is another other herb. We want to, obviously, again, remember we're talking about progesterone deficiency, estrogen excess, so we want to regulate our hormones. So we want to have any kind of herbs that are going to regulate. Vitex, also known as chasteberry, black cohosh, dong quai, those are great hormone regulators. And then we also, again, we want to look at our anti-inflammatory, like ginger is a really great, ginger is really good for anti-inflammatory in even the pelvic region as well. So ginger tea is definitely a wonderful thing to do. And then you want to do some pain management. Well, it depends on how you basically, when you do herbal medicine, you may be like for over the month, kind of basically getting the liver going, getting the hormones regulated, but then when you're having this pain, you need to have some kind of pain management. And there's lots of different herbs that you can use for that. There's like valerian, there's cramp bark, there's Jamaican dogwood, there's, again, ginger, chamomile, which is also antispasmodic, which are really great herbs for pain management. And then another herb that is actually great for women that are pregnant is red raspberry leaf, which you can do as an infusion. It is a little, I did have a video on herbal infusions. It was in my newsletter. If you aren't signed up for my newsletter, make sure that you sign up because you'll get those great videos, and I'll actually, I got to post that herbal infusion because everyone should be doing herbal infusions. They're awesome, awesome, awesome. But that's another whole conversation. But red raspberry leaf is considered a uterine tonic. It's, you know, a lot of women that when they're pregnant, they take it. And there was actually research that showed that women who took red raspberry leaf infusions during pregnancy, they had better labor outcomes as compared to women who didn't. So, and red raspberry leaf is, it's a little, what we call astringent. When you drink it, sometimes you got to drink a little extra water with it because you can actually feel when you, I know at least for me, when I do my red raspberry infusion, my fingers after a little bit after just, you know, from drinking it one day, it happens pretty quickly. Your hand gets a little dry. Your lips get a little dry. It's really amazing how much herbs can really affect our bodies. So that's it for, in a quick nutshell, 30 minutes of endometriosis. As you know, this is just a little quick, basic information. This is all educational. Make sure if you're going to do anything that you make sure you talk to your healthcare provider. Make sure that you respect and honor the herbs. I say this with every show. You respect and honor pharmaceutical drugs, then you need to do the same thing with herbs. Herbs are nature's medicine. They can interact with medications you're taking. They can cause, some of them could cause high blood pressure, or, you know, lots of different things that you want to make sure that it's okay for you to be taking them. So always, I recommend that you talk to somebody that is knowledgeable in herbs. You can make sure that you tell them everything that you're taking, tell them all that what your medical problems are, so that you make sure that whatever you're taking is okay and healthy for you. It's nature's medicine. They can have interactions and they can have side effects. Most of the time, the side effects, you just stop the herb and it all goes away. But if you can prevent it beforehand, knowing that that may possibly happen with the medical condition, then that's a lot better. So, that's it for this evening. Thank you, Evan. I see Evan showed up. Fiona, hello. Welcome. And Donna, she's going to message me more about herbs. Absolutely. Definitely email me, reach out to me. I'll definitely be able to, you know, help you as much as I can all about that. Remember, if you have not signed up for my newsletter, please, please, please do. Go to womenshealthonthego.com, sign up. You get a percentage off of your first visit. You get a great little e-booklet I made on all great things to do for breast health and vagina health. So make sure that you definitely sign up for that. And if you have somebody that you think may have endometriosis and just want some basic information, then please share this video. Share it with your friends on Facebook. I would really appreciate to love spreading the word about women's health on the go. And just, you know, I love talking about women's health. I love trying to tell everybody everything that we possibly can to empower ourselves. We're women. We're powerful. We're wonderful. We're awesome. And women's health matters. Our bodies matter. So we have to make sure that we take care of ourselves. Okay, everybody? So next week, I'm going to be talking about meditation. I think there's lots of different types of meditation, and as I'm always talking about stress reduction, I think it's really important that we start adding meditation to our lives. So next week, that's what I'm going to be talking about. So I hope to see you next week. I hope you have a fabulous week. I hope spring is in the air and this crazy weather just, I don't know, I just want it to go away. I want warm, beautiful weather. So take care of yourself. Have a great week, and thank you very much, everybody. Have a great one.